You may find this hard to believe, but right now, millions of people are living with diabetes, and they have absolutely no idea. They still feel normal. They continue walking around, going about their daily routines, caring for their families, and enjoying life as usual. There's no severe pain, no fainting, no dramatic warning signs, and because everything seems fine, they believe their health is still under control. But the frightening truth is this: diabetes rarely knocks loudly. It enters quietly, silently, patiently. And long before a blood test has the chance to reveal the problem, your body has already been sending signals for help. What surprises many people the most is where these first signals appear. Not in the heart, not in the eyes, but in a place that seems completely harmless: your feet. In more than 20 years of practicing medicine, I've met countless patients who walked into my office with the very same words: "Doctor, I don't understand how this could be diabetes. I still feel healthy." And when we looked back together, the signs had been there for months, sometimes even years. They simply hadn't recognized them. Not long ago, a 67-year-old man came in for a routine checkup. He was retired, maintained a fairly healthy lifestyle, walked every day, and rarely needed medication. He told me he felt healthier than many people his age. But when I asked what seemed like a very simple question, "Have you noticed anything different about your feet lately?" he hesitated. Then he mentioned occasional numbness, nights when his feet felt burning hot, making it hard to sleep, a small scrape from his shoes that just wouldn't heal. He assumed these were simply signs of aging. His fasting blood sugar that day was 214. He had been living with diabetes for more than 2 years, without ever knowing it. And what troubles me the most is this: those signs are not rare. At this very moment, they are appearing on millions of feet, possibly yours, someone in your family, or someone you love. The good news is that if you recognize them early, you can completely change the trajectory of your health. And the very first sign we need to talk about is also the one that most people have experienced at some point, yet almost always ignore. The first sign often arrives so subtly that you might simply laugh it off. It's a tingling sensation, like tiny pin pricks, or as if your foot has fallen asleep for a few minutes and then returns to normal. Most people explain it in very familiar ways. Maybe I sat too long, maybe I crossed my legs, maybe it's just aging. And sometimes that explanation is completely reasonable. But what truly concerns doctors is when that tingling starts to appear more frequently. There's no clear reason, no awkward sitting position. You could be walking, cooking, or watching television, and suddenly feel a wave of numbness spreading across the sole of your foot. Some describe it as ants crawling. Others say it feels like a mild electric current. Some can only call it a vague discomfort they don't quite know how to name. This may be one of the earliest signs of peripheral nerve damage, one of the most common complications of prolonged high blood sugar. Imagine your nerves as extremely fine electrical wires running throughout your body. Each one is wrapped in a protective coating that allows signals to travel clearly from your brain down to your feet. But when blood sugar remains consistently high, that protective layer begins to wear down little by little. It doesn't hurt immediately. It doesn't fail all at once. But the signals gradually become distorted. And that distortion is exactly what you experience as tingling or prickling sensations. What makes this so dangerous is how quietly it happens. Many people live with it for years without ever checking their blood sugar. By the time tingling turns into complete loss of sensation, the damage has already progressed much further. But it doesn't stop there. The second sign often causes even greater anxiety. And for many patients, it leads to nights of lost sleep. This is the sensation of burning feet, especially at night. During the day, you may be too busy to notice. But when you lie down in a quiet space, with nothing left to distract you, you begin to feel as if the soles of your feet are smoldering. There is no external heat source, no visible wound. Yet your brain continues to receive the message, hot. This happens because damaged nerves start sending incorrect signals. Some people stick their feet out from under the blanket to cool them down. Others have to splash cold water on their feet in the middle of the night. Some believe they have a fungal infection, an allergy, or are simply exhausted. In reality, this may be an early warning that blood sugar has remained high long enough to affect the nervous system. The good news is that at this stage, you still have many opportunities to slow, and even reverse, the progression. One simple but extremely effective habit is walking regularly for 20 to 30 minutes each day. You don't need to run. You don't need intense workouts. Just consistent movement to improve blood flow to the nerve endings. At the same time, begin reducing added sugars starting today. Drink enough water to help your kidneys flush out excess glucose. And increase fiber from leafy greens, legumes, and oats to slow the absorption of sugar into your bloodstream. And if these nerve-related signals are the early alarm bells, then the next signs we're about to discuss are directly linked to circulation and wound healing, where the situation can start to become truly dangerous. But if tingling or burning sensations are only the early warnings, then the next signs are when your body may truly be in real danger. This is the stage where the problem is no longer just about how you feel. It begins to show itself through visible changes you can see with your own eyes. And the consequences of ignoring them can sometimes be irreversible. The third sign often starts very small, a minor scrape from shoes rubbing, a blister after a long walk, a tiny cut while trimming your toenails. Wounds that once would have healed within a few days now linger for weeks. You tell yourself you just need more patience. You wait a few more days, then another week. But the truth is that when blood sugar remains high, over time, the small blood vessels that nourish your feet begin to narrow and stiffen. Oxygen, immune cells, and essential nutrients needed for tissue repair can no longer arrive on time. The wound becomes an open doorway for bacteria. Imagine trying to water a garden with a hose that is bent and restricted. The water is still there, but it cannot reach where it's needed. Your body works the same way. Its ability to heal itself slows down day by day without you realizing it. Many cases of diabetic foot ulcers begin as nothing more than a small, ignored scratch. The fourth sign can be even more concerning because it is visible right in front of you every day, yet easily misunderstood. It is a change in skin color around the ankles and the tops of the feet, a patch of skin that looks darker than usual. Reddish purple, or slightly bluish. Many people assume it's due to sun exposure, aging, or simply natural pigmentation. But when blood circulation declines, the parts of the body farthest from the heart, especially the feet, receive less oxygen-rich blood. The skin begins to signal that it is undernourished. Over time, it becomes thinner, more fragile, and slower to recover. Then comes the fifth sign, the one that surprises many patients the most. Chronic cracked heels. Not the kind of seasonal dryness that comes and goes, but deep, persistent fissures that remain even after trying countless moisturizing creams. The cause is not only on the surface. When the autonomic nerves are damaged by prolonged high blood sugar, the sweat glands begin to function poorly. The feet lose their natural internal moisture. The skin becomes like a wall whose mortar is gradually crumbling between the bricks. These cracks are not just painful. They can become dangerous entry points for infection, especially when circulation is already weakened. This is the moment when many people begin to enter a spiral of complications they never imagined they would face. And if you think the problem stops at the feet, The next signs will reveal how high blood sugar may already be silently affecting even more vital organs deep inside the body. But when poor circulation and slow wound healing begin to appear, the story is no longer just about your feet. This is the stage where high blood sugar starts to affect the entire system of your body more deeply. What you see in your feet is actually just the tip of the iceberg of a chain of changes taking place in your kidneys, blood vessels, and nervous system. The sixth sign often makes people complacent because they assume it's normal after a long day. This is swelling in the feet and ankles. You might notice it when you take off your socks in the evening and see deep indentations left on your skin. Or when you press a finger gently into the swollen area and the dent remains for several seconds. This is not just simple fluid retention. When blood sugar stays elevated for a long time, the filtering units in the kidneys gradually become damaged. The kidneys can no longer regulate fluid balance as effectively as before. Fluid begins to pool in the lowest parts of the body, the feet and ankles. If you ignore this signal, the pressure on your heart and blood vessels may increase day by day without you even realizing it. The seventh sign can be even more alarming because it shows up as a type of pain many people misunderstand. A shock-like pain. Sharp, piercing. Some describe it as if a hot needle is stabbing into the sole of the foot. What's unusual is that this pain doesn't come from any obvious injury. It often appears while you are resting, especially at night. The cause lies in nerves that have been damaged by prolonged high blood sugar. Instead of transmitting accurate signals, they become overactive, sending false alarm messages to the brain. Many patients take painkillers for months without realizing they're only masking the nervous system's cry for help. Then comes the eighth sign, a quiet signal that reveals a great deal about vascular health, constantly cold feet. Not just in winter, not only after sitting for too long, but cold even on warm days when the rest of your body feels completely normal. When blood vessels become narrowed and stiff after long-term damage, warm blood from the heart cannot effectively reach the farthest points, like the toes. This persistent cold sensation is like a room at the end of a hallway that never receives enough warmth from the central heating system. The good news is that even at this stage, you can still make meaningful changes. Develop the habit of elevating your legs while resting to help fluids and blood return toward the center of the body. Reduce salt intake to limit fluid retention. Maintain brisk daily walking to encourage your blood vessels to function more efficiently. And don't forget to gently massage your feet in the evening to stimulate circulation and calm the nervous system. But there is still one final sign. A sign so silent that many people don't even realize it is happening. And that is precisely what makes it the most dangerous of all. And now we come to the final sign, the one I almost never need to ask about, because most patients don't even realize it is happening. There's no pain, no itching, no obvious discomfort. But when I point it out, they often fall silent for a few seconds. They look down at their feet and then say something very familiar. "Oh, I've never noticed that before." It is the gradual loss of hair on the lower legs and the tops of the feet. It may sound trivial. Many people even assume it's just a normal part of getting older. But in reality, hair follicles require a steady supply of blood and oxygen to continue growing. When circulation becomes impaired over a long period, as happens when high blood sugar silently damages the blood vessels, these follicles slowly begin to shut down. Not suddenly, not dramatically, but little by little, over time. Imagine a small garden. If the irrigation system starts to clog, the plants don't die right away. They simply stop growing. The leaves become sparse. Life is still there, but it weakens day by day. Hair loss on the legs is very similar. It is a sign that the pathway carrying life, your bloodstream, is no longer flowing as strongly as it once did. What makes this sign the most dangerous is its silence. There is no pain to draw your attention, no wound to cause concern, only a subtle change that you can easily overlook for years. Today, we've walked through 9 signs together, from mild tingling sensations to nighttime burning, from slow healing wounds to changes in skin color, from cracked heels to swelling, nerve pain, year-round cold feet, and finally, the quiet disappearance of hair on the legs. 9 opportunities for your body to tell you it's time to get checked, so I want you to do one very simple thing tonight. Before going to bed, sit down, take exactly 30 seconds to look closely at your feet. Observe your skin. Check whether there is numbness. Look between your toes. Notice any cuts, cracks, or color changes. Just 30 seconds. But it could change the entire future of your health. If you recognize even one sign from this list, call your doctor tomorrow. Not next week. Not next month. Tomorrow. Because diabetes is not always a frightening life sentence if it is detected early. In many cases, it can be well managed with a balanced diet, regular movement, and proper medical monitoring. If you found this video helpful, share it right now with someone you care about. And don't forget to subscribe to the channel and turn on notifications. Every week, I'll bring you honest conversations about health after 60. The kind of insights many people only hear when it's already too late. Be proactive. Listen to your body. And start with your feet today.